the Office of Standards and Technology with the Office of the National Coordinator for Health Information Technology. Today we are discussing the Standards Exploration Awards, or C, Cooperative Agreement, and this is the informational session regarding the Standards Exploration Awards Cooperative Agreement Funding Opportunity Announcement. A few housekeeping tips before we get started. This webinar is being recorded and will be made publicly available at the website on your screen within 2 weeks of this session. All phone lines will be muted during the presentation, and if you have questions, please enter them into the questions box. All questions will be answered in the form of a FAQ and will be made publicly available each week on the High Impact Pilot and Standards Exploration Awards funding opportunity pages on healthit.gov, and the links below will get you to the FAQs. If you have additional questions after today's session, please direct them to the following email address, onc.techlab@hhs.gov. To start, we have some background about this funding opportunity announcement. On May 9th, ONC released 2 funding opportunity announcements for the High Impact Pilots, or HIP, and Standards Explorations Awards C Cooperative Agreement Program. This webinar is for the C, and it has $250,000 available with 3 to 5 expected awards. They will be cooperative agreements. The period of performance will be 12 months total. Letters of intent are due by June 10th, 2016, and applications are due by July 8th, 2016. The project objectives are to focus on addressing interoperability through implementation of technology solutions. Also to support increased use of health information technology solutions, incentivize use of standards from the Interoperability Standards Advisory, or ISA, a newly emerging standard. And the lessons learned and evidence generated by these cooperative agreements will help advance industry understanding of health IT's potential. There are multiple priority categories and subcategories for this funding opportunity. They are comprehensive medication management as a priority category, and the subcategories are drug costs at care and opioids. Care coordination is also a priority category, and subcategories for this are care plan and closed loop referral. Labs are a priority category, and the subcategory is full loop labs. And there is a self-identified priority category which enables applicants to identify a priority category of their choosing. There are 7 impact dimensions for this funding opportunity announcement. They are practice efficiency, safety, privacy and security, clinical quality, patient experience, cost efficiency, and interoperable exchange. For the C, you are required to choose 1 out of 7 impact dimensions. If you choose to apply to the High Impact Pilot, the difference between the C and HIP is that you choose 3 out of 7 for the High Impact Pilot. Recipients must use best available standards or emerging alternative standards from the 2016 Interoperability Standards Advisory, or ISA, which is a coordinated catalog of best available standards and implementation specifications developed and used to meet specific interoperability needs. If there is no standard included in the 2016 ISA that addresses a need for interoperability within the applicant's project, applicants may propose and justify rationale for using an alternative standard that can meet unaddressed, compelling needs of the evolving healthcare ecosystem in lieu of using a standard from the 2016 ISA. This slide depicts a framework for the funding opportunity announcement. The next slide shows the different tasks associated with this funding opportunity announcement. Task 1.1 focuses on project plan execution. The deliverable is to schedule a kickoff meeting with O&C, and the due date is within 10 business days of award. Subtask 1.2 also focuses on project plan execution and is to submit the final project plan to O&C, due date within 4 weeks of award. Subtask 1.3 is the interoperability proving ground entry. The deliverable is to submit an entry into the O&C's interoperability proving ground website summarizing the awarded project, and the due date is within 6 weeks of award. Subtask 1.4 is deployment of technology solutions. The deliverable is to hold a kickoff meeting with project collaborators, and this should happen within 5 business days of O&C approval of project plan. Subtask 1.3 is to present project results on virtual webinar. Subtask 1.5 is to present project results on virtual webinar. The deliverable is a presentation of project results on a virtual webinar, and the due date is 6 months after the date of the award. Task 2, submit final report. The deliverable is the final report, and the due date is at the end of the 12-month period of performance. Task 3, if applicable, is engagement with standards development organizations. The deliverable is a copy of a transmittal to standards development organizations, and the due date is 30 business days prior to the end of the period of performance. To recap the deliverables, recipients will be required to present project progress to date on a virtual webinar with O&C 6 months after the date of the award. Recipients will be required to submit final report at the end of the period of performance that includes a description of processes for implementing the technology solution, lessons learned, key findings, data related to measuring the impact dimensions, and a description of the project's potential for widespread use. In the event that the recipient identifies gaps or changes to currently used standards, it must work with the appropriate Standards Development Organization, or SDO, to recommend updates to any standards and/or implementation guides per the SDO's guidelines. This slide depicts example measures for the priority categories. Please note that these are examples and they are not required. For comprehensive medication management priority category, one example is point-of-care price transparency solutions use a standards-based approach to enable automatic access to prescription copay information in real time. Another example is comprehensive medication management can be achieved through team-based care involving pharmacists or pharmacy services. For the laboratory data exchange priority category, the example is a lab order is created by a clinician, sent to an outside lab, administered by the outside lab as ordered, and the results of the lab test are returned to the ordering clinician into their preferred EHR system. For the care coordination priority category, an example is primary care physicians, or PCPs, that refer patients to a specialist track the status of the referral and exchange information with the specialist in order to manage subsequent follow-up care. Another example is patients with 2 or more chronic conditions that require ongoing management for which a patient-centered care plan is electronically captured and shared. There is also a self-identified priority category. The following slide depicts example measures for the impact dimensions. For the practice efficiency impact dimension, example measures demonstrated increase in number of providers accessing prescription drug monitoring program, or PDMP, data within workflow. For clinical quality impact dimension, example measures are improvements in HEDIS scores, lower emergency department readmissions rates, improvements in population health outcomes. For the cost efficiency impact dimensions, Example measures are reduction in duplicate payments for lab services, reduction in staff resources necessary to accomplish standard processes. Patient's prescription drug copay is displayed at the point of prescribing to aid decision-making. For the patient experience impact dimension, example measures are patient experience receiving care measured through Hospital Consumer Assessment of Healthcare Providers and Systems, or HCAP, improvements in the number of patients viewing, downloading, or transmitting their health information, increases in patients' ability to actively engage with their providers, including uploading patient-generated health data. Safety impact dimension. The example measures are reduction in the percentage of charts with allergies in free text versus structured or designated fields, reduction in the percentage of incorrect patient ID alerts in barcode medication administration, improvements in the patient matching rate. For the privacy and security impact dimension, example measures are improvements in the patient matching rate, increase in the use of encryption and secure transmission of health information, improvements in the access control that further limit risks of unauthorized disclosure. For the interoperable exchange impact dimension, the example measure is increase in the proportion of individuals, office-based physicians, hospitals, and behavioral health, long-term care, and post-acute care providers that send, receive, find, query, and use, integrate electronic health information, have electronic information available from outside sources, and make electronic health information available to outside sources, and use electronic health information to inform decision-making. These are just examples, and applicants are not required to use these measures. The next slide depicts the timeline for the funding opportunity announcements for the C Cooperative Agreement and key dates. The FOAs were publicly released on May 9, 2016, and that will finish on 7/8/2016. Letters of intent are due on June 10, 2016, and the application period ends on July 8, 2016. The award recipient's announcement date is targeted for 8/29/2016, and the targeted period of performance for awardees begins on 9/5/2017. Sorry. The targeted award date for the period of performance begins on 9/6/2016, and it ends on 9/5/2017. And now I will turn it over to my colleague Lynette Young to discuss funding, eligibility, and application information.
Thank you, Caroline. The summary of key details: the type of award is a cooperative agreement. Available funding is $250,000. Number of awards is between 3 and 5. The application due date is July 8, 2016. The anticipated award date is August 29, 2016. The period of performance is 12 months. Anticipated start date is September 6, 2016. Notice of intent. Applicants are encouraged to submit a non-binding email notice of intent to apply. Please submit this by June 10th, 11:59 p.m. Eastern Time. Please identify the name of the applicant organization, the type of organization, the city, state, the FOIA number, and the title, Standards Exploration Awards, SEA. Please note that if you're to announce and update the FOIA notice, the FOIA number, it should be capital NAP AX-16-004. And please send all of your information to onctechlab@hhs.gov. Eligible applicants. If you are a private nonprofit institution and organization, public nonprofit institution organization, and private or profit or for-profit organization with proven knowledge of familiarity addressing interoperability through implementation of health information technology. Applicants may apply for both HIP and the SEA Cooperative Agreement programs. In the event an applicant chooses to apply for both programs, they must select different impact dimensions for their application. Application components. We have a different presentation. This is not the one that I sent you. Application components. The abstract is less than 500 words. The project narrative is 25 pages. The Form SF-424, Application of Federal Assistance, no limit. The Form SF-424A, Budget Information for Non-Construction Programs, no limit. The SF-424, Assurances for Non-Construction Programs, no limit. Budget Narrative, no limit. Form SF-LLL, Disclosure for Lobbying Activities, no limit. Letters of Commitment, no limit. Proof of nonprofit status, if applicable, no limit. Indirect cost agreements, no limit. Work plan, no limit. The project abstract. The project abstract represents a high level of summary of the project that can be understood without reference of other parts of the application, that can provide a description of the purpose of the project, including the project's goals, objectives, overall approach, anticipated outcomes, products, and duration. The format of this piece should be no more than 500 words, single space. Please indicate the project title, applicant name, physical address, contact name, contact phone numbers, email address, website if applicable. Project narrative. The project narrative should address the elements articulated in the program description, purpose, and structure, and approach sections in the FOIA. Align with the performance goals, program milestones, and merit review evaluation criteria presented in the FOIA. If an application does not follow the outlined format, it will not be considered for further review. The format for this piece is double-spaced with no more than 25 pages. Format 8.5 by 11 letter size, plain white pages. Either Cabela or Times Roman format. Cabela or Times Roman font. 1-inch or larger margins, and font size 11 or greater. Budget narrative and budget forms. Complete the following budget forms to document costs and proposed budget activities. Budget narrative on how the proposed budget aligns with the applicant's project narrative. Application for federal assistance, Form SF-424. Budget information non-construction programs, Form SF-424A. Assurance for non-construction programs, Form SF-424B. Disclosure for lobbying activities, Form SF-LLL. Detailed budget instructions are provided in the FOIA. Project plan. Please refer to page 17 of the funding opportunity announcement for detailed requirements for the project plan. It is important to format the project plan as an 8.5 on 8.5 11-inch letter size pages, 1-inch or larger margin, and the font should be size 11 or greater. Application responsiveness and objective review. Application review process. Submit all application materials electronically through grants.gov. Grants.gov issues an email receipt upon successful submission. ONC issues receipt upon successfully obtaining files from grants.gov. Applications are reviewed for responsiveness and completeness as categorized as pass or fail. All applications that pass the review of responsiveness are forwarded to the objective review. Once the objective review is complete, O&C will make the award. O&C is not obligated to make an award if none of the applications meet the intent of program requirements or if funding levels or availability changes. For assistance for submitting applications on grants.gov, please contact grants.gov help desk at support@grants.gov, or you may call 800-518-4726. Have a Duns & Bradstreet Universal Numbering System number. Please register in the System Award Management, SAM, at www.sam.gov. Please allow a minimum of 5 days to complete the registration. If you're already registered in SAM and have not renewed your registration in the last 12 months, you must renew your registration. Ensure the application meets all requirements and page limits. Now I will application responsiveness criteria. Applicants not meeting the following completeness criteria were administratively eliminated and not sent to merit review. The applicants meet eligibility criteria. The application is received by the deadline required by July 8, 11:59 p.m. Eastern Time through www.grants.gov. The application contains all required components, the project narrative, the SF-424, etc. The application meets all formatting and length requirements. Appendices and attachments are not used as a mechanism to exceed the page limits of the project narrative. Now I will turn it back over to Caroline to move forward. Thank you.
Thank you, Lynette. I will now talk about the merit review criteria. Responsive applications are forwarded for merit review. Merit review conducted by a review panel of at least 3 experts in their field from academic institutions, nonprofits, and local and federal government agencies. Applications can receive a maximum of 100 points using the following scale. Understanding the requirements, 15 points. Staff qualifications, roles, and responsibilities, 15 points. Technical approach and organizational capacity and readiness, 35 points. Proposed impact dimensions, 10 points. Reasonableness of the budget narrative, 10 points. Innovation and development of technology solutions, 15 points. Understanding the requirements. The extent to which the applicant has identified a thoughtful and coherent set of challenges and opportunities associated with the adoption and use of health IT standards to support interoperability. The extent to which the applicant understands the proposed priority category that will be addressed through this project. The extent to which the applicant understands the healthcare system and the need to increase adoption, interoperable exchange, and the integration of relevant data from external sources or unaffiliated organizations. The extent to which the applicant understands and communicates the scalability and impact their proposal will have across the industry. Staff qualifications, roles, and responsibilities. The extent to which organizations' roles and responsibilities are clearly defined and aligned with the goals and outcomes of their project. Strength of evidence that the project brings the highest level of talent for the chosen focus area and that the project will integrate the efforts of these experts. Description of talent should include project management, health IT standards expertise, and ability to evaluate outcomes. Technical approach and organizational capability and readiness. The extent to which the proposal addresses the identified challenges. The balance and appropriateness of the proposed project scope, project timeline, and project management plan. The extent to which the applicants have the resources and infrastructure to accomplish project objectives and deliverables. Proposed impact dimensions. The extent to which the applicant has communicated a valid and useful set of measurements associated with their selected impact dimensions. Innovation and development of technology solutions. The extent the technology solution proposed by the applicant to support the advancement and use of standards shows innovation and creativity, as well as demonstrated alignment with the goals of widespread interoperability in health IT. Budget narrative and justification. Proposed levels of effort of the project director and key personnel are adequate to advance the project in accordance with timelines. Budget is justified with respect to the adequacy and reasonableness of resources requested, and the amount of the budget allocated to administration is minimized while still allowing coherent management of an integrated project. Adequate justification to support costs is included in the budget. All questions must be submitted in writing either via the chat box during this webinar or emailed to onc.techlab@hhs.gov. All questions will be answered in the form of an FAQ and will be made publicly available each Monday on the High Impact Pilot and Standards Exploration Awards Funding Opportunity Announcement pages on healthit.gov. The websites for the HIP and C awards are listed below. We appreciate your attendance, and we will remain online for 5 minutes, so please submit any remaining questions via the question function on the webinar page. To see the FOA on grants.gov or to apply, go to http://web/grants.gov/view-opportunity.html?OPPID equals 283657. For assistance with submitting applications in grants.gov, please contact the grants.gov help desk at support@grants.gov or call at 800-518-4726. Please submit your questions. We have 5 minutes remaining. Three minutes remaining. Please submit your questions. 1 minute remaining. Please submit your questions. We are now ending this session. Thank you for attending.